And now, a prescription for precision, unlocking effective healthcare and marketing strategies.
All right. Well, thank you all for being here today. I have the great pleasure of helping host our panel, specifically talking a lot about healthcare. We have three amazing panelists with us here today. I'm very excited to introduce first Trevor. Trevor Bezdek is the co-founder and chairman at GoodRX. GoodRX, for those of you are not as familiar, is the digital marketplace that is the largest digital marketplace for healthcare. They're a publicly traded company that has saved consumers over $75 billion. Started the company back with his friend Doug Hirsch back in 2011, where they found that there was an unmet need for consumers, where they want to better understand, compare costs, be able to compare and contrast them, and understand what pharmacies they should be getting them from. In 2019, they were recognized by Fortune's Change the World list as one of the key companies helping the planet in tackling society's unmet needs. Trevor was co-CEO until 2023 and transitioned into the chairman role, and has been named as Goldman Sachs 100 most intriguing entrepreneurs in both 2017 and 2019, and now serves on the board of Stanford Institute of Economy, Policy, and Research. Thank you for being here today, Trevor. Kate Shamsuddin is our Chief Strategy Officer at Definitive Healthcare. Definitive Healthcare is a leading healthcare commercial intelligence providing data, analytics, and expertise to help companies across the healthcare ecosystem. Their platform offers deep insights into analytics for hospitals, physicians, payers, and patients, enabling organizations to identify the best opportunities, streamlining their go-to-market strategies. Kate started her interest back in college, focusing on global health, health policy, and management, and has explored many different areas within healthcare, from health policy work for CMS all the way to product development at BCBS. Before her role as the Chief Strategy Officer, she was the Chief Product Officer at Definitive Healthcare, and currently leads the company's operations and customer teams, strategic initiatives, and corporate development. She's also the GM of Advanced and Promotional Analytics Groups. And finally, Jeff McCollum from Global Medical Response. He's the Senior Vice President of Growth and Innovation. GMR is a leading provider of emergency and patient relocation services in the U.S., offering medical care both via ground and air transport, and are committed to delivering life-saving care whenever and wherever needed, using advanced technology and a vast service array to help healthcare access across communities around the world. He started in emergency medical services with no background in the space, but he then very quickly learned, because he had a very deep experience around data-driven business decisions, working for a visionary company with cutting-edge thinking ahead of their time. Jeff started as a paramedic and developed into his role from the ground up, leveraging his hands-on experience to shape the innovations that they have today. And he's worked in every aspect of the business, from regional operations president to innovations and growth today at GMR. Thank you all for being here today. I appreciate it.
Thank you.
So when we started working in the healthcare space, we very quickly identified an opportunity where we could work on both the provider side as well as the patient side, enriching profiles with thousands of attributes and signals to help us better understand the most important use cases. Like for the healthcare provider side, being able to understand the research they're doing, the conferences they're attending, also like what are their values they have as a healthcare provider. While on the patient side, we wanted to look at studies around conditions that you're pre-genetically disposed to from your country of origin, and then also do comorbidity and adherence studies, and also being able to understand the circles of influence we have around each other, and then be able to not only engage them in endemic channels, but across our omnichannel solutions. So when we're thinking about innovation, we're thinking about the gaps in the marketplace. I would love to hear from either your own experience at your companies that you guys are at, or from what you've seen in the marketplace, what innovations have really inspired and really resonated with you guys? Maybe I'll start with you, Trevor.
Sure. So what's worked well for us is making marketing opportunities actionable. So for GoodRX, people come to GoodRx when they need to get prescriptions. And it is the most common place people go in this journey of trying to figure out how to get a prescription, how to navigate that process. And so more people will come to GoodRx to try to figure out how to get Humira than would go to Humira.com. And that's true for essentially every brand drug. And so we've tried to make, in addition to educating consumers and providing like those opportunities, we've tried to make actionable opportunities for them. And so one thing we're doing with pharma brands where we're helping them market is providing directly to those consumers opportunities to use copay coupons for insured consumers. We find that users who get those copay coupons are twice as likely to fill the prescription as people who did not get that offer. And then for cash-paying consumers, because something's not covered or because of other reasons, we offer, again, ways to get those prescriptions at cash. So for example, today I believe we launched a program with Neffy, which is a new needle-free alternative to an EpiPen. And you can go to GoodRx, learn about the product, but then also get a discount to get that at the lowest possible price that's available in the market. So that's something that's worked for us.
Yeah, it's very cool. I'd love to also maybe pivot to Kate's point of view, like coming from a different side of the industry. What have you seen to be particularly relevant?
Yeah, so I think it's a great question. I think one of the things that we're most focused on is how do you actually bring measurement and understand kind of innovation through measurement so that you can be really effective. Now, I think there's a tremendous amount of kind of supporting technology and analytics and support out there, really trying to mature how we think about kind of omni-channel and what that delivery looks like. We're really focused on thinking about how do you actually get to not only kind of prescriptive ways of getting in front of your consumers or your HCPs as an example, but also predictive ways in terms of getting in front of consumers or patients in those same exact HCPs. So we spend a lot of time really thinking about measurement, which kind of breaks into two different areas. So the first is just general evaluation. Like, are you doing the right things? Are they really effective? Do you have the right channel mix? Are you talking to the right customer segments? Is your segmentation cued in the right way? And then there's also another side to that coin that's really focused on optimization. So based on what you learn, really just driving some of that innovation on how you want to bring your particular kind of message to the market. And so across the board, we're really trying to think about how does technology drive that measurement? How does technology really kind of drive that innovation so that when you're iterating on data pretty quickly, when you're actually running your analyses in real time, we then can put in front of our customers, we can then put in front of people that are trying to market, how do you really think about the right triggers to get in front of the right patient at the right time when their physician is treating them. So we're really focused on kind of driving innovation through that measurement lens.
Amazing, I love that. And what about Jeff, from your perspective?
Yeah, so Global Medical Response is a healthcare provider that focuses on emergency air and ground services. So we are the provider of the services. And our organization was really beneficiary of one of the, probably one of the most successful public health type of marketing campaigns ever, and that is in case of emergency, dial 911. And so that program continues today and has been really very successful. And everyone knows the whole concept about how to access emergency care. Unfortunately, what we're seeing in the market right now is that there's a segment of the population that uses 911 as a methodology to be able to access healthcare. Well, that's a problem because it ends up draining resources that were set up for the emergency care. So in 2018, our organization piloted a program, we call it Nurse Navigation in Washington, D.C. And essentially with that program, what happens is the caller calls in to 911, and instead of us going through the process of trying to just send resources, what we've done is we have a nurse that intervenes in the low acuity call on the phone in an effort to be able to resolve that patient's issue, whether it's through self-care or potentially direct them to an urgent care or some other methodology because they're not truly a medical emergent. So far that program has been very successful. We're now in like 25 different cities around the United States, and the program is growing pretty exponentially. Today, we've managed over 200,000 patients in this program. And so, we're very proud because I think what you're going to see is a transformation how EMS is delivered in your communities.
That's amazing. And speaking of that, do you feel that that has kind of given more healthcare services to some communities that have had unmet needs before?
It's a good question. And one of the things that we've done associated with the data is we look at the data that comes in associated with those requests. One of the things that we see is that the historically underserved communities are the biggest utilizers of this solution. And so by doing that is we're starting to see the entire effect that we're actually assisting these individuals in how to bridge and get access to health care. And one of the things that we take pride in is that we want to make sure that that patient is getting what they're needing. And so we'll actually, 24 hours after the event, we'll actually survey those patients to identify and make sure that their medical needs were met. And number two, they were satisfied with how that care was delivered. And we're really proud to say that on a scale out of 5, we're 4.7 is what we're surveying right now. So we're very pleased with how the program is going.
Yeah, no kidding. That's amazing. That's awesome. When we were thinking about updating our latest economic indicators in July, we saw that job sentiment was down before the jobs report came out. Mm-hmm. We saw that there was about 114,000 jobs created in July, which was lower than expected. But you know what? 55,000 of those jobs came from healthcare. So it's very evident that healthcare is growing and continuing to grow. I'd love to hear from you guys, from your perspectives. What areas do you see the most amount of growth, or perhaps where the biggest gaps are? And maybe we'll start from the data side. Maybe Kate, we'll start with you to talk a little bit about that.
Yeah, absolutely. So I think a couple different areas that we've really observed in the last couple of years. I think the first to underscore is just kind of this real growth in omni-channel and how that really kind of surrounds how you want to show up for your customers at the end of the day. I kind of liken it to when you think about omni-channel, you've got a lot of noise coming at you kind of at all given times. And I think the real growth, particularly in this segment, is going to come from how do you really translate some of that cacophony into what feels like a better symphony, and changing what that surround sound looks like. Sometimes that might come commercially speaking, sometimes that might come from a marketing angle, sometimes that might come from the angle of how you're actually really kind of analyzing and kind of using data to drive that problem forward. But I think just a general growth of really thinking about omni-channel, and I think particularly in healthcare, not just being so siloed where you're really thinking about promotional analytics, you're thinking about the patient journey and the experience that they might have, but really trying to tie those two things together. So again, you can kind of build towards that, I think, symphony. I think the other thing that we've started to realize is that there's so many folks that are always interested in kind of looking at real world data and seeing how that can kind of drive them forward. I think there's a ton of growth opportunity and really just trying to make sense and logic of that data. I think as data has become more commoditized over time, I think really driving analytics and insight around it becomes the area to focus on so that you can think about really impacting and I think driving just better patient outcomes and health across the board.
Yep, and that truly matters also, right? Trevor, from your perspective?
Maybe I'll say one area of growth and maybe two areas, there's gaps that I see. So on the growth side, I'd call it consumer centricity or something like that. When we started GoodRX, one of the big observations or just facts of the American healthcare system that made this work is that Americans are spending more and more out of pocket themselves. So, the American consumer is having to, your employer and you is paying a lot for health insurance, and then you're also spending a lot. And that amount has become really sizable for consumers. It's much more than you're spending in a lot of other categories of your consumption. And you'd think, with recent, regulatory changes and things that would have improved, but if you look over the last few years, that number's only increased further. So consumers do have this big burden, and there is more and more efforts to try to go directly to the consumer. So you're seeing some interesting things from pharma, like Lilly Direct and Pfizer for All, and some direct-to-consumer offerings, and I think you'll see more of those. So I think that's an area for growth. In terms of gaps, one I would say is sort of equitable access to information. Healthcare, people don't understand healthcare, and people don't understand how to navigate healthcare. People don't understand any of the words and terms we use for healthcare. So, we ask people to navigate this incredibly complex system, and we ask them often to do it when they're sick. and people are unsuccessful. You know, if you ask how many people understand what a copay is, what a deductible, what out-of-pocket max, all this, it's like less than 15% of American consumers understand any of this. And you look at America as a whole, and we spend as a percentage of GDP one of the most of any countries in the world, or the most, I think, of any country in the world, and yet have pretty poor outcomes overall. And you know, I think this is one aspect that contributes to it. And then the other area I'd bring up is I have a slight addiction to TikTok. And so I see as I go on TikTok more and more medical professionals and medical information on TikTok. And I find this both sort of exciting and sort of frightening all in one bundle. And I think the exciting point is people are making really engaging content. You know, you're like watching something, you know, about, I mean, like literally anything nowadays, and you're like, oh my God, I gotta watch this is great. So that's cool. But then on the other side, the amount of misinformation that's being presented to consumers is only increasing. And so you see someone in a white coat presenting information that's like totally wrong. And so I think that's going to be an increasing challenge of how do marketers handle this world of, you know, like super engaging content that people are getting that has misinformation. You're trying to present real information and yet be engaging enough to not be ignored. And I think that's going to be an interesting challenge people are going to face here.
Yeah, and I think your pain point also goes back to your customer centricity, because the lack of education or the understanding of what is out there, I think goes back to better meeting the consumer's needs as well. Jeff, maybe from your perspective?
Yeah, I'll just talk about gaps for a second. You know, as an emergency helicopter provider, EMS provider within rural communities, we're seeing a bigger and bigger growth associated with healthcare deserts that are starting to take hold, particularly in rural America. And you know, the reality is that the needs of those patients need to still be met, and the helicopter service becomes anchoring for those citizens to be able to have a connection or access to healthcare. And I think that it's like, for example, one of the things that we did in order to, from a marketing perspective, we partnered with Zeta associated with putting together a program. It's what we call our membership program. And essentially, it's another way for us to be able to have some revenue that comes in to pay for the high cost of readiness to provide that service. And that program has been, you know, incredibly successful and has been able to inflow additional dollars into to our company so that we can be able to maintain those services in those communities. And at this point, we have around 5 million members in rural America that are actually supported by that program. So I think it's also about being very creative associated with about how you can actually create the funding sources to be able to make sure that these programs are sustainable.
Absolutely. And maybe this is me fishing for what's next on our product roadmap to help meet some of these needs and gaps. But if you had a magic wand, and there's one thing that you would want to be able to fix or change or whatever it might be, perhaps maybe some of the generative AI stuff, what would that be, and what do you think that impact would be as well? Can you start with you, Trevor?
I think when you started and we're talking about what Zeta is doing, that seems great. You know,
I hate him to say that.
No, I think you know, we're in an environment, consumers value their privacy appropriately, especially around health information. It's not necessarily been, you know, and that is a challenge because, you know, you want to have privacy, and yet you also want to be able to serve them content that is the right content to them. We don't want a perfectly generic pharma ad for some product that, you know, hopefully we'll never need being broadcast, you know, to everyone ideally. You know, we want content that's relevant to us and appropriate, and yet we also want to value privacy. And you know, you can imagine a magic world where, you know, you have patient data, you're serving someone the exact right thing, and you're also doing that though, you know, it's actionable, and they can do stuff about it, it guides them along the path, gets them to better healthcare, it saves money, makes better health outcomes, all this stuff. But yeah, it's how do you also do that in a way of really respecting that user's privacy, making them comfortable along that journey.
Absolutely, and you know the best out of all of us being on the board with all the policy and healthcare making, so appreciate that point of view. Maybe Jeff from your also kind of.
Yeah, this is the one question I really hate, but anyway, you know, the personalization of healthcare in terms of how the data, the acceleration of the HIE, the exchanges associated with health information exchanges, you know, making healthcare personal, and being able to have it to where when you're as a clinician, when you're interacting with that patient, you have all that history at your fingertips. That would be such a fast track associated with being able to deliver more effective care, and I know that that's where we're working toward, but we still have a ways to go.
Absolutely, great. And Kate, from your perspective?
Sure. I do want to come back to something that Trevor just mentioned, because this is an area where, like, if I could actually wave a wand, I'd love to see some kind of advancements in stability, is really just thinking about kind of leveling around data privacy and what it means to be compliant, I think, in today's world in a way that feels really, really respectful to consumers and obviously what they're experiencing and what's going on in their own personal lives, but also creating an opportunity to get in front of them and really have kind of advancement from a healthcare and a delivery point of view. And I just think this notion of really trying to have kind of the right balance between what does data privacy look like and what does precision look like, which is a little bit of what Jeff is saying in terms of kind of this personalized healthcare, more precision medicine. It is a tension in the market right now, and I think it's a tension in how we all show up and think about the ways in which we can actually drive, honestly, just some real positive improvement for the patient experience. So I think definitely hitting on that point is a really important one. Maybe just to come at it from a slightly different angle on the generative AI side is, you know, I personally have seen, I think, lots of vendors, lots of partners out there doing some pretty remarkable work, and I think really being on, I think, the cutting or the bleeding edge. And it's great to see kind of the investments that they're making just so that others can really learn, particularly in a space that's evolving pretty rapidly. And I think what I am personally excited about in terms of generative AI is just some of the conversational analytics that you're actually starting to see play out, and how generative AI and natural language processing primarily is kind of a driver behind that, is really just creating an enormous amount of value. Because I think about, I'll put myself like just your average person, like trying to make good decisions on a daily basis. How do you actually take kind of reams of data, turn that so that analytics is much more democratized than it has been, and then using that to really kind of stand up and take actions and really kind of drive forward. So I'm personally excited to see what it can do also within the marketing front.
Absolutely. We love generative AI here too. We call it something similar too. We call it the democratization of intelligence. And I think a lot of what you guys are all talking about is to give the information and put that into the hands of the consumer. Would love to hear, Trevor or Jeff, if there's any other applications that maybe you guys hope for that could be applied for generative AI?
I think it's tricky. I think if you look at medical information, I recall that when I think it was like ChatGPT 3.5, they compared people's answers, answering a question with ChatGPT versus a physician, and then rating those responses on medical quality and on sort of how much the people liked them. And people liked the responses so much better from AI than from the physician, but clinically they weren't quite as good. And then ChatGPT 4 comes out, and now people like the answers better, and they're better than the clinicians, or equal to the clinicians. And so, you know, you can see that generative AI works incredibly well, except there's also this uncomfortableness with it. I think one of the BetterHelp or one of the other mental health services did some chatting, like we're coaching with patients. They did an internal test, which was criticized later, but where they used generative AI to respond. People were perfectly happy with the responses. But as soon as they knew they were generative AI, then they were unhappy with the responses. And today there was an article in New York Times, I think, saying how people are upset that Epic, the EMR software, it's making it easier for your doctor to send you AI responses, and they're not telling the patients. And so I think I mean, this isn't an answer. This is like the problem that's interesting, yeah. where it's like generative AI works, like in this case, pretty well. I mean, let's ignore the cases where it doesn't, but broadly speaking, this can be very helpful for productivity, everything else. It also does cause a discomfort with people. How do you bridge that? How do you like effectively make it known that you're using it, make people comfortable, and yet still make them like it, when it is this incredible productivity tool that's possible.
Yeah, absolutely. Great. And Jeff, anything you want to add?
Our organization is very cautious associated with how fast we move in the AI space. And we have done a couple of little pieces. The program I spoke to earlier about nurse navigation, in Seattle, we actually used we listened with a AI to be able to listen to the call as it was being, came into the call taker. And the intention is to be able to provide prompts to that call taker about how best to be able to refer that patient. And so that's been very effective associated with being able to make recommendations to a human being associated with what next action should be. We're also looking at, we haven't done anything with this yet, but virtual voice agents. It is amazing how incredibly human-like some of those interactions can be using those virtual voice agents. And so we see that as a potential opportunity, particularly with call centers or dispatch centers, to be able to use that. But again, that's a very crawl, walk, run strategy on our side.
For sure, and I saw what Jeff was talking about. It's pretty cool. It actually gave me some ideas how we can improve our interface as well. And before we wrap up today, I want to thank you all for not only being visionaries and innovators in the marketing space, but also all of your contributions toward bridging the gap between these really groundbreaking healthcare solutions with the people that need it the most. And it's truly my hope for all of us that we continue to push innovation. We help facilitate some of that collaboration, and most importantly, don't forget about bringing and improving wellness and health to all. So thank you so much for all being part of our journey in this very important period.
Thank you.
And coming up next, the art and science of making data-driven decisions.